Everyone. So our next speaker is Aileen Harper. She's with the Center for Healthcare Rights, and she helps people navigate the intricacies of Medicare and Medi-Cal, which become very important, especially for older people with money issues. So here's Aileen. Thank you.
Thank you. All right. Well, thank you for coming out today. So. I want to start by telling you about the agency, and I didn't pass these out, but on the table that says Center for Healthcare Rights, there's one of these postcards you can take that has our 800 phone number. It's in English and Spanish, and we also, for those of you who are interested, also have them in selected other languages as well. So the Center for Healthcare Rights, we're a nonprofit healthcare advocacy organization. The agency has been in existence since 1984, and the organization has done different things in terms of healthcare advocacy, but the core element of our mission has been to provide assistance and information with Medicare, Medi-Cal, and other health insurance as it relates to Medicare. So our client populations are primarily people who have Medicare, but also their family members, their caregivers, people who contact us because they have concerns or issues about, the people that they care about. Our services are free, and we're funded primarily through the California Department of Aging Health Insurance Counseling and Advocacy Program, which is a statewide program here in California. There are 24 HICAPs across the state. We are also part of a network of programs across the United States, which go by the acronym of the SHIP programs, which is State Health Insurance Program. And there is a Medicare SHIP program in every state. Now, different programs look differently, but all the programs are designed to provide information and help with Medicare. Most of the other SHIP programs across the United States don't specialize in Medi-Cal, but we do. Our services, you can contact us if you have questions or problems relating to Medicare, Medi-Cal, or whatever the issue is, by calling our 800 hotline, which is open Monday through Friday, 8 a.m. to 5 o'clock. We don't sell insurance, we don't endorse or recommend any insurance products. So sometimes when people call us, they'll say, well, I'm new to Medicare and I know that I need a supplement, so tell me what I should buy. So our role is not to tell people what insurance to buy. Our role is to help you better navigate a very complicated Medicare program. And so what we do is we talk to people, whether it's the client turning 65 or becoming Medicare eligible, or a family member or friend. We're talking to them about, what is the Medicare question or issue, if they're new to Medicare, what are the gaps in Medicare coverage, such as co-payments and deductibles, and then the benefits not covered by Medicare. And I think at least a couple of the speakers already have identified for you major gaps in Medicare coverage. Medicare doesn't pay for dental, Medicare doesn't pay for hearing aids, and primarily and most importantly, Medicare does not pay for custodial care either at home or in a nursing home setting. And a lot of the speakers have already shared with you, stories in terms of their work, and I want to emphasize to you that one of the things that we see daily is family members or friends who do not have a clue, who call us and the situation is now an emergency, where mom or dad, they've been in the hospital and they need to leave the hospital and it's unsafe for them to go home. There is nobody at home, they were living alone, and now the family is trying to figure out, okay, what are we supposed to do? And there's these unfortunately unrealistic expectations that Medicare is going to pay for it. So I think all of us, who are in the field, we understand these issues, but a lot of families in the community really don't know until something major has happened, where suddenly that older adult needs the long-term care and they need it urgently. And they're trying to figure out very, very quickly what is available to them and what resources they can rely upon. So one of the things that we do is we talk to family members about, okay, we know the gaps in Medicare, so what does Medi-Cal cover? Are you potentially eligible for Medi-Cal? Is the family, is the client eligible for Medi-Cal? And we look at Medi-Cal in two ways. Medi-Cal in the community, meaning they're applying for Medi-Cal, and essentially they're going to be remaining in the home, and we're reviewing the eligibility guidelines for Medi-Cal in terms of income and resources, and they are very, very limited. I mean, the income limit for a single person living at home is $1,270 per month, which is very, very low. And the asset limit is $2,000, with some assets obviously being exempt, like the home. We also look at, okay, so if the person wants to apply for Medi-Cal long-term care, what are the options? And there is the nursing home option. And so we would review with them, okay, so if you're looking at potentially applying for Medi-Cal long-term care and entering a nursing home where Medi-Cal's paying for it, what are the income rules, what are the asset rules? And as someone already pointed out, the legal team that spoke, there are different, more liberal rules for married couples that apply for Medi-Cal long-term care. And these rules apply not only for nursing home placement, but also now to in the community when the person's applying for in-home supportive services. So what we can do is provide you with basic information about these Medi-Cal rules with regard to Medi-Cal, Medi-Cal long-term care, and then refer you to other resources for more detailed information. Another area that we help with is eligibility issues relating to Medicare. You know, we have a very large older adult population who came here late in life and they have questions about eligibility for Medicare. We can talk to them about if you're not getting Social Security, you know, when you can apply and what Medicare costs. In addition, we also do a lot of education and advocacy about Medicare Advantage plans, Medicare HMOs. And the reason for that is that more than 60% of Medicare beneficiaries in LA County are in Medicare Advantage plans. And sometimes people will have problems where they believe they're having access to care problems. I want to see a specialist. Mom is in the hospital and they want to discharge her tomorrow. The plan or the medical group says mom doesn't need any skilled nursing facility services. She doesn't need rehab. What are our rights? And so those are things that we can help with as well. One thing I do want to mention is that we also see, and I think this is sort of piggybacking on some of the other speakers, is we see people who do not plan ahead, which everybody has talked about, but specifically plan in terms of advanced care planning. You know, what type of medical treatment do you want? What kind of medical treatment do you not want? And so it's important to have that outlined in a written document so that your loved ones know in advance, you know, what life-saving measures do you want, what life-saving measures you don't want. So again, I know that you've had sort of a bit of a long evening already with lots of speakers. So if you would be interested in talking to us, please pick up our postcard, which is on the table there. Thank you very much.
Thank you. Okay.